Well, look at there. It is that day. It is that time. It is the Healing Docs Show, brought to you by Absolute Healthcare. Check them out online as we speak at absolutehealthcare.org. That's absolutehealthcare.org. Several locations to serve you with the Healing Docs available just for you. You can call them anytime, make your appointment online. Whatever you got to do, make sure you go to Absolute Healthcare. 3 locations to serve you: Spring Hill, Port Richey, and of course, Tampa. They're waiting on you. In the meantime, we've got a great show once again for you today, the Healing Docs Show with, of course, Dr. Malhotra and Dr. G, otherwise known as, and Dr. Gupta have made their way into the studios once again to assist us, to educate us, to entertain us, and of course to bring us the information that we need and deserve according to our health. Now, last week we were talking about blood pressure. We've talked about sexual health and overall well-being. Of course, we started off with weight loss, which is so important to us. Another thing that is also important, and you hear a lot about it in the news lately, about cholesterol. How do I know if I have high cholesterol, low cholesterol, no cholesterol at all? I don't know, but we're going to find out because the docs are here to tell us, and that's why we turn to the professionals, the experts in the studio, as cholesterol is important not only to me, but to you, and of course, your doctor at Absolute Healthcare. So once again, doctors, welcome, and thank you for bringing up, or of course, I brought it up, but thank you for expanding on it and answering some of the questions that I have, and of course, some of our listeners have on cholesterol. So we're going to talk about that today. So once again, welcome.
Thanks for having us.
Yes.
Thank you.
Okay, so first of all, what are the different types of cholesterols?
So this is actually a good question, because a lot of the times we hear things, circulating around between other people and other patients, even some other doctors, that there's, good cholesterol, there's bad cholesterol. Mm-hmm. And what are they called, and what are the different types, and what even is cholesterol, and why is it important in the first place? So the different types of cholesterol are generally classified by acronyms. LDL and HDL are typically the ones that we refer to. LDL we typically refer to as the bad cholesterol, and HDL is what we typically refer to as the good cholesterol.
Ah.
Mm-hmm. And the D stands for the density. So L is the low density, which means it's a little more fluffy. HDL is dense, high density, so it's a little more compacted. And then we have 5 different types circulating in our blood, and we can measure all of those, but typically we measure, direct measurement of it is a little different. And of course, it's very important because we know that it has a huge impact on what can happen to you from your cardiovascular standpoint, which means heart attacks and strokes.
Right. It's gotten a bad rap over the years where actually we need cholesterol, right? Because the good cholesterol, right, and the bad cholesterol. Now, a question I have personally, will bad cholesterol kill me?
So I think it really comes down to risk. So just like with weight management and other topics that we've discussed, and balance and falls, you put yourself at a certain risk when your bad cholesterol is at a bad number. And it's not necessarily something that we would say is going to cause you to, knock over today, but it's something that over time puts you at a much higher risk for the things that Dr. Malhotra mentioned, which is strokes and heart attacks and other types of vascular diseases that we can even explain to our patients. And that can be anywhere an artery is in your body, which fortunately or unfortunately, if your cholesterol is bad, is all over the place. So that cholesterol can build up in arteries in your legs, in arteries in your eyes, in arteries in your arms or fingers. So you don't want the bad cholesterol to build up, because those bad cholesterols end up sticking to the walls of our arteries and then causing more problems down the line.
Yeah, just like, if you were to pour oil down your drain pipes, you are going to clog them up, not immediately, but over time it's going to build up and build up and build up. And that's why the county has what is called those grease traps for restaurants, so that our entire system doesn't get clogged up. Mm-hmm. So we definitely don't want this high level of something which is risky to be there.
Just like with blood pressure, let's talk numbers. What are the numbers that we're shooting for? And the magic number, of course, LDL, HDL, and you brought up oils as well. I know there's good oils and bad oils that we consume.
Correct. So the LDL itself is generally considered to be below 100 as a goal for most people. This is when we're trying to prevent a stroke or a heart attack to happen in a person that needs help with their cholesterol or has never had bad cholesterol in the first place, and we want to keep it at that good level. Now, if you've already had what we call an event like a stroke or a heart attack, those levels change because we want the numbers to be even lower than that. The current guidelines from the American Heart Association is less than 70, but we were actually just looking into it yesterday and today that even below 50 is something that we can try and shoot for. So we don't want those numbers to approach anywhere near where we would typically start treatment in the first place for someone that's never had an event. So if they have had one, then those numbers change, and the goals and the numbers change as well.
And you brought up oils, Dr. Malhotra. So tell us about some oils, like good ones, bad ones. What should we do?
Good ones. I think massage oils are good.
Yeah, there you go. not WD-40 or 1030 or whatever.
That's right. You know, the oils that come out of fish livers are good because they're rich in omega-3 fatty acids. So those are the better ones. Then, of course, we want whether we want the polyunsaturated oils or the saturated oils. And we want those oils to be used which remain liquid even in room temperature, like canola oil, peanut oil, vegetable oil, olive oil, these ones, as opposed to butters and, nowadays ghee, which is an Indian version of clarified butter that's becoming popular. So we don't want those on your table, or only minimally to be used compared to the ones that remain liquid.
Okay, very good. Now, coconut oil has hit the market pretty heavily within the last few years, and I think it has to do something with maybe your Alzheimer's or dementia, or people are scared or concerned. And so tell us a little bit, put us at ease as far as coconut oil is concerned.
You know, I think people have related coconut oil to Indians, and we're considered very intelligent.
Yes.
Or there is a lack of dementia, not so much dementia in India. But when I look at the absence of dementia in India, I also note that the lifespan in India is very low. So if the average lifespan is low, you will see a lower incidence of a disease. It's not necessarily related to one particular thing that we consume. One has to think of other factors that prevent dementia. And the best that we guys recommend for patients in our office is actually exercise or dancing or ping pong, both of which have actually objectively shown to improve our brain volumes. So coconut oil is not something that we recommend.
Yeah, cognitive health is very important, especially as we age. And as we age, what should we be looking for? Are there signs or symptoms, or say we've never had our cholesterol checked before? Tell us, as once we hit 30, 40, 50, the decades there, the guidelines, what are we looking for?
So there are physical exam findings that you can see with very high cholesterols, and usually it's what we call atheromas, and there's different names depending on which part of the body we find them on. But typically, we don't want to be finding those, and you should be screened well before, findings of very high cholesterol for a long period of time are found. So most often what we do is when we're doing general blood work for an annual exam or a semi-annual exam, we're checking for these cholesterol levels to begin with, even if we don't know what your levels were to begin with. And the other thing is, some guidelines recommend doing it every year. Some say only if you have a certain risk, do it every 3 or 5 years. So we tailor that to our patients depending on what type of risk we think they have based on their other medical conditions.
And the healthy doctors at Absolute Healthcare want to make sure that you're healthy as well. So Absolute Healthcare are the ones we trust and recommend and suggest here at this station, and we want you to turn to them for all of your needs. Absolute Healthcare, 3 locations that serve you: Spring Hill, Port Richey, and Tampa. Give them a call. Check them out online right now, absolutehealthcare.org. You can make your appointment there. Okay, so let's say you see something in our annual blood test, and the LDL levels are a little high. What will happen if I leave that cholesterol untreated?
So leaving cholesterol untreated over time leads to what we were already alluding to, which is the buildup of cholesterol into our arteries. Okay, so when that happens, it's called atheroma or atherosclerosis, however you've heard it. It's just different forms of essentially the same thing, which is the buildup of what we call plaque in the arteries. Over time, the arteries can begin to narrow, and depending on where the artery is, can lead to a heart attack or a stroke or a vascular event in, for example, your leg. So what we typically recommend is when we're educating a patient about what it's doing to our body, we're letting them know that if left untreated for a long period of time, these plaques can build up to such a high level or degree that they completely block off your artery and the blood flow to the organ that the artery is supplying, or it could rupture and break through the wall of your artery and cause a massive event like a heart attack. So depending on the actual outcome, they all sort of lead to the same thing. Is it going to put you at a risk for a heart attack, a stroke, or some other cardiovascular event? And that's what we want to prevent, because this is not an overnight thing, and it's something that, just like what we mentioned with blood pressure, it's a silent killer. It's something that really takes its time and is slow, and you don't feel it, and you don't necessarily know if the medicines you're taking for it are doing anything for you. So that's why we think it's so important to educate the patients and everyone, including ourselves, about what it is we're doing and why we're doing it.
And just, finding a high cholesterol level doesn't mean we'll immediately start you on treatment. We'll have a long discussion about it. We want to find out what your other risk factors are. Do you have a family history of heart disease? Are you a smoker? Do you have high blood pressure? Do you have what's called metabolic syndrome? And for that, we have other tests that we can do. We can do your glucose test, a glucose tolerance test, multiple stuff that we can check to see whether you are at risk. Just one number doesn't decide that we're going to jump onto medication or to intervention. We really have to assess the entire individual before we'll have the next step. And for that, I think a very nice thing is a dialogue and explaining to the patient what we're doing and why we're doing it. And that's exactly what Dr. Gupta was pointing out this morning, that sometimes people just reflexly start treating. Hey, high blood pressure I see, start treatment. High cholesterol I see, start treatment. And that is not the ideal way of treating the individual customized. These are population studies, but an individual might be very different. So, like you mentioned today, that the ratio of the total cholesterol to HDL would be so important. So it is not just one number, that LDL, that people might focus on, but other factors that we like to see as well go along with it to decide what is best for the patient. And then to discuss with the patient what their fears are. Because everybody has, I don't want to take a medicine if I don't need to. Yeah. I'm afraid of what the consequences, the side effects are going to be. So all that discussion takes place before you would leave the office.
Right. Your health and wellness is their main concern, and they're going to try and do whatever they can to get you there without medication. But just in case, when would I start cholesterol medication?
So there's a few reasons to start it. The most direct and obvious way is if your cholesterol level reaches a certain number. For example, if your LDL number goes above 160 to 190, depending on which guideline you're going by, we would recommend starting it, again, with also assessing your other risks. If you have diabetes, it doesn't even matter if you have high cholesterol and you're over the age of 40 years old with diabetes, you should be on cholesterol medicine. And these are some of the other things that we typically have to educate a patient about, because one of the common questions I get is, why do I even need to take cholesterol medicine anymore if my cholesterol numbers are good? Why can't I stop? And there are many situations where the cholesterol medication is indicated to do and to be on regardless of your cholesterol level. For example, if you've had a heart attack or a stroke, you should be on cholesterol medicine to prevent the next one, regardless if your LDL number is in the perfect range, because it does, independently of your cholesterol numbers, reduce your risk of the future event from happening. So there are other reasons to be on them, and we always typically recommend to be on them for patients that meet certain criteria, like Dr. Malhotra was already mentioning.
And there are very few exceptions to that rule. Very, very few exceptions. So we watch out for those as well. But by and large, let's say 99% of the patients that we'll see in such situations would benefit from the medicine. And the problem is that there is no immediate relief that the patient sees, and that is why they fear or they worry, hey, it's not doing me any good, nothing's broken, why am I starting this? And I think that is when the discussion and the explanation and the outcome studies and what has already been checked in research with double-blind controlled studies has already proven that we start to educate the patient. Because the real meaning of the word doctor is teacher.
Yes.
Is not a healer. So we are here to educate them so that they can carry that change in their lifestyle and their treatments lifelong.
So it's a big problem. This is America, of course. It's not India, so it is a big problem here amongst Americans. And we know that our eating habits and our lifestyles...
Even in India now.
Oh, really?
Obesity, 40%.
Oh, my goodness.
It is terrible. It's terrible. You know, the fast food craze has started all over the world.
Yeah.
So, and the bigger portions to attract more people and get them addicted to food and sugar is there. So, the entire planet suffers from it. Wherever people can afford to eat these, heavy calorie foods, they're eating them.
Well, we'll talk about statin drugs and other kinds of medication we can take if we are considered to have bad cholesterol levels. But in the meantime, you brought up the fact about this food. What kind of foods should we be consuming to keep our cholesterol levels down?
So in general, we recommend a lower fat diet. And this sort of goes back to the types of diets that are recommended for weight loss.
And blood pressure. Remember we talked about the DASH diet, the Mediterranean diets.
Correct.
Those are the ones you should focus on.
And in some senses, this can make our job and recommendation to a patient easier, because the same recommendation we could have for weight loss diets or for blood pressure diets can all sort of coexist with the same diets that we would recommend for a low cholesterol diet and healthy foods. So if you're not just trying to do an isolated thing, like purely I just want to lose weight, I don't care what I'm eating, I just going to reduce the calories, or if we take things to the next step and to the next level of advancement and actually talk about the foods that go into it. So yes, low-fat foods are generally considered the better way to go, as well as the amount of oils that we were already talking about, because oils get broken down by our intestines and then they get transported into our bloodstream, and then that's what contributes to our total cholesterol levels over time.
There's too much fried food out there, and that can be an issue. How does it affect our other organs?
Because the arteries are being clogged up, wherever blood supply is needed is going to function less.
Okay.
Be it the heart, be it the brain, be it the eyes. In the eyes, we start to see what's called arcus lipidus, which means there is a round white circle in our corneas, which are relatively bloodless. Even those are starting to accumulate cholesterol rings. So it's happening everywhere, right from the age of 1, where we have seen fatty streaks start to form in the arteries. So the nidus starts to form, the seed starts to form way at a young age, and then everything and everywhere. It's like a highway. You have nice open highways, traffic can flow easily, supplies can reach wherever they're needed. If there's a crisis somewhere, those roads help us get stuff over there. You block those roads, everything and everywhere, you're going to have mayhem.
Traffic jam, yeah.
It's traffic jams.
Yeah,
yes,
absolutely.
we can't get, our body and organs cannot receive what they need for daily maintenance and healing.
And every major organ in our body has their own highway. So every single highway can become affected.
Yeah, your kidneys, your gallbladder, your pancreas, your thyroid, right? All that.
Absolutely everything.
Wow.
Even down to the skin on your body.
Yeah.
The word cholesterol comes from bile, gallbladder area.
Ah.
Chole means bile, steros means solid, and then you add an alcohol end into it. It's called cholesterol. So it's a Greek word, and so yes, every organ gets affected by it.
Wow.
And a very nice thing that, as we were on diet, was that if a person can lose weight, every 1.8% or approximately 2% of weight loss leads to anywhere between 5 to 8% decrease in cholesterol. So those diets are, contributing to everything. Lower blood pressure, lower weight, lower cholesterol, better mentation, lower chances of cancers of the colon, lower chances of breast cancer, lower inflammation in the body. So the whole body system starts to become what it should be.
And the good docs, the healthy docs, will get you started on that path to health and wellness, starting from the very beginning, building all the way up to help you in your aging process. They've got 3 locations to help you: Absolute Healthcare, one in Spring Hill on Mariner Boulevard, Port Richey Ridge Road, and in Tampa on East Bush Boulevard. The healthy docs are here to make you healthy, and they'll sit down with you. They'll educate you. They'll inform you, just like they do on this show here. They'll do that right there in their office, because that's why they are here. And you need to make your appointment at Absolute Healthcare absolutehealthcare.org, absolutehealthcare.org. Okay, you brought up the fact that we can see, or you can see as a doctor in different tests and panels, etc. You can see it from the very early stages in life. Is there a genetic component to this cholesterol?
Yes, absolutely.
Okay.
Absolutely. And, there is a lot of research going on about genetic disorders and their eventual and hopeful, treatment of the actual genetics that lead to worse outcomes for some people and not for others. But there does come down to a lot of political and ethical things when you start talking about altering someone's DNA. So we generally tend to say, what you're born with is what you've been given. And what we try to do is control the things from the environment that can contribute to worsening a problem. And sometimes your body has the ability to, maybe your parents had a slightly high cholesterol but never had a heart attack. And or they had a heart attack and their cholesterols weren't, very bad to begin with. So these sort of people that are in a range where they really just need a push in one direction or the other can also benefit just by changing what we recommend in their diet or in their weight or in the pills that we ask them to take if they want to learn more about them. So yes, genetics always, we think, play a major component, and this is always coming down to the nature versus nurture, aspect of medicine. But we tend to focus on the nurture part because we believe that's something that we can change on a daily basis for a patient.
Very good. And that's why family health history is so important, and you need to let your doctor know what's going on in your family and what has happened in the past.
And in fact, we use that to calculate some of your risk.
There you go.
And it could be the deciding factor of whether we should start treatment or not.
Dr. Gupta, Dr. Malhotra in our studios from Absolute Healthcare once again on the Healthy Docs Show. Welcome. We're talking about cholesterol. Got a few minutes left to go. In the meantime, we mentioned statins and other drugs that we can take for cholesterol. So we'll go ahead and continue with that. What kind of drugs should we take, and what kind are you going to prescribe us?
There are multiple generations of cholesterol pills. We came out initially with a medicine called lovastatin, and people even prior to that were taking natural stuff to heal or lower their cholesterol, and things worked. And they still work, but to what degree is what you have to answer, and then decide what medicine, what side effects, which one will be tolerated. And the newer generation ones have a much lesser chance of causing side effects like muscle aches and dementia, which is a major concern of a lot of people. And the statins that we guys use in our practice are those that have the lowest risk of dementia, lowest risk of muscle aches. As a matter of fact, many of them have the same as placebo. So there are studies to prove that the people who got medications without knowing whether they were a statin or not, and the people who got placebo and they did not know whether they were getting a statin or not, the amount of muscle aches were the same in both groups. Once they were told that this is the medicine, the side effects went up by 25-26%. So just like we have the placebo effect, we have something called the nocebo effect. Nocebo means that the negative impact of what the drug could do comes to our mind, and we start to imagine it a little more. In many patients, it is a real problem. And in those situations, we try and lower the dose or stop the medicine for a little while and then restart it at a lower dose and then gradually climb our way up. Or even if those who have just got myalgias, we sometimes recommend coenzyme Q10 because that can reduce the incidence of muscle aches and pains. Then, of course, with those people who are taking the lipid-soluble statins like Lipitor or atorvastatin, we convert them to other ones which have a lower chance of causing dementia. So there are things that we focus on in the types of statins to say which one should we pick for our patient.
Because we also think that, even in my own experience, there's a lot of stigma when it comes to cholesterol pills, especially statins. They think that with the medication that they're at a higher risk of an adverse event to happen to them, because many of the times they often are not as educated about the topic, and even ourselves, which is why we wanted to do this topic, about why we're treating it in the first place. So the fact that a side effect could exist can generally happen with any and all medications that are available to prescribe, even over-the-counter stuff. So we always have to tell the patient that we're doing something that we think will benefit them more than the risk that they're taking of taking the medication in the first place. And with statin medications, in particular, there's a lot of stigma around them and the potential side effects. We tend to see over time that many people will tell me, oh, I'm allergic or this or that about the medication, or I did get the muscle aches. And I try to focus on what exactly was it that happened when you took those medicines, which medicine was it, because they're not all the same, and see if it's something that potentially we could recommend starting again. After giving them the full book of information, and we try to digest that ourselves to make it easier for someone to know.
As a matter of fact, I started taking a statin. I started at the 10 milligram dose, and I started to get muscle aches. I stopped it, and then I went retried it at 5 milligrams and tolerated no muscle aches at all. Then I raised it to that 10 milligram dose, which initially gave me muscle aches, and even at that point, I had no muscle aches, and I'm continuing to take it right now.
Interesting.
So people, it's a matter of not being afraid of something that is good for you, but try again and see, hey, I might be able to take advantage of this wonderful intervention that is there. Of course, in the right setting with the right risk. For instance, I have a family history of cardiovascular disease. My father had a heart attack.
Yes.
So I wanted to mitigate that and said, how can I minimize this risk? And I started the medicine.
And some statins can reduce your risk of stroke or heart attack by 50%.
Wow.
And there are not many medications that we can say can do such a drastic change in someone's risk for such a terrible disease like a heart attack or a stroke.
And at any age.
Yep.
Yeah.
Typically, we try and start about the age of 40. Our practice, of course, focuses on the seniors, the elderly, but I think the screening should start off right from the age of 20.
Okay. All right. Well, we got a couple minutes left. How do you want to wrap up, bring us to the home stretch?
So another common question I get is, what Dr. Malhotra mentioned it a second ago, was about the CoQ10. We hear it about a lot, or coenzyme Q10, however you've heard it before. And it's often advertised on television about something you should be taking if you're on one of these statin medications. The thought being that coenzyme Q10, which is a part of muscle enzyme activity and a metabolic activity that our muscles have, can be depleted when we take the statin medication. And there have been studies to show that yes, coenzyme Q10 can be lowered when you take these statin medications. Unfortunately, though, the association with taking coenzyme Q10 with a statin medication hasn't necessarily shown a true benefit. And that's why the American Heart Association still does not recommend doing it with a statin medication. Routinely. But there are sort of anecdotal times where it can and has been shown to reduce the symptoms, or maybe what a patient would perceive as those symptoms, like muscle aches. But it's mostly considered to be something to help with muscle aches, and it's not necessarily something you have to take if you're on a cholesterol medicine, because it's money. It costs money. You buy this from Nature Made or one a day for men or women, and you're spending $20, $30 a month just to take this enzyme that hasn't necessarily been proven to be useful.
In the last 60 seconds, one last question. If we're not on a statin, should we take CoQ10?
No.
Okay.
CoQ10 is recommended only if you have symptoms of myalgias, which is muscle aches. Any worse than that of a side effect is not typically prevented by CoQ10. So, not at all. A message I want people to get is that, yes, statins do have side effects. In the right situations, the benefits far outweigh those side effects. And in the right hands, the choice of the correct statin for you can prevent these in the long term as well. For instance, in our practice, we do not initiate atorvastatin or Lipitor almost ever, never. So we use the other ones which have shown to have better benefit as well as lesser side effects. So you have to be in the hands of somebody who deals with this on a day-to-day basis, continues to enhance his or her own practice in an academic setting like what we guys do in our office here, and cares and pays attention to the things that people are taking, and not just be a refill doctor.
And that's what this show is all about. You're in good hands with the healthy docs at Absolute Healthcare. They'll help you on your way to health and wellness and to enjoy those golden years. Give them a call or check them out online right now, absolutehealthcare.org. In the meantime, we'll see you next week attacking the issues that mean the most to you from the healthy docs. From Absolute Healthcare, Dr. Malhotra, Dr. Gupta, thank you so much, gentlemen. God bless you. See you next week.
Thank you so much.
Thank you.
Awesome. That was great.